Hello, and welcome back to another episode of the Soft Tissue OT podcast. My name is Jordan, the Soft Tissue OT, and today's podcast we're doing something a bit different. I'm going to answer the top 10 search questions on Google regarding low back pain. So we're going to start at number 10, going to work our way all the way down to the number one most searched question regarding low back pain, and that number one question might actually surprise quite a few of you, so stick around for that one. So without further ado, let's get stuck straight into it. So these are the top 10 questions. Number 10 is, do I need surgery for low back pain? Well, it's an interesting one, and one that we actually discussed quite in depth with Professor Stuart McGill on our podcast episode with him. So if you haven't gone and seen that one, check it out. But the thing about surgery is that surgery alone does not address the root cause, right? It's just cutting out a piece of sensitized tissue. Rarely is the tissue that is being targeted the only cause of pain. So you need to actually address the root cause of the issue. So identify why that sensitized tissue is being aggravated and actually address that, right? So say, for example, you got a disc bulge, they go and have a microdiscectomy. Sure, you're cutting away the protrusion that may be causing pain or also compressing nerves, causing referral issues and nerve pain. But you haven't addressed why that happened. And we see it all the time in the clinic with so many different patients end up re-herniating or causing another disc bulge because you actually haven't addressed the root cause, right? So what is actually causing that issue? And on top of that, it's often the case that patients who go in for surgery might not necessarily need to go into surgery straight away. And so we always say that surgery never ruled off the table, but it should always be the last resort that we go to. So we should be exhausting all other issues. Now, with that being said, there are a few red flags that may point towards surgery. And for the right person, right time, we're all for surgery. We're just not for the wrong surgery at the wrong time for the wrong person. So those red flags are, number one, neurological issues such as what we call cauda equina, which is where you get loss of bowel or bladder control, saddle anesthesia. You can also get real significant weakness like foot drop or you can't move the leg. That's probably one red flag that we would investigate a bit further and look into surgical options if necessary. Then unretractable nerve pain. So if we're getting pain that's, for example, the lumbar spine radiating down the sciatic or femoral nerve, and nothing we can do can change that pain. We can't lessen it. We can't put you in a position where it reduces a bit. That's unretractable nerve pain, and it tends to get increased over time. And then the last case is trauma, right? If the cause is like a broken bone, they're in a car accident or something like that, torn tissues often need to be stabilized. So those are the ones that would probably look at surgery more seriously. Question number 9, why does my low back hurt in the morning? Most of the time, people think that it comes from stiff or tight muscles. That is completely incorrect, right? So when we're dealing with stiffness in the mornings, we like to put it into 2 categories. So the categories are on older spines that we tend to be dealing with more arthritic issues, more facet joint arthritis, arthropy. Then that will tend to be more of an inflammatory response that they're dealing with. The arthritic changes and things that are occurring overnight are increasing in inflammatory response, and therefore that inflammation comes in and contains pain sensitizing chemicals like calcium and histamine as part of the inflammatory response, and that inflammation just hangs around and then makes those joints feel a little bit more stiff and sensitive. And then the second part, for the younger spines, that we're dealing with more discogenic pain, which means from the disc, the pain's originating from disc. It's due to the hydrophilic effect, right? So the hydrophilic effect is when at nighttime, when we're lying down horizontally, gravity's compression on the disc is no longer significant. And so the hydrophilic effect of the disc is actually absorbing liquid. And that's how it actually gets its nutrients. It goes through the end plates and then gets via osmosis through into the actual discs themselves. And it's a natural process that every one of our spines are going through. But the thing is, when we're lying down horizontally, as we said, compression of gravity is smaller. And so that osmotic or hydrophilic effect is greater. And then that's where those discs actually absorb liquid and they absorb water. And then what ends up happening is that they actually get bigger, right? So the discs themselves can actually increase in the liquid content. Sometimes research shown up to 300% more volume of liquid in the discs in the morning than lasting at night before people go to bed. And so it's actually that increase in the disc height, the increase in the content of water that disc has. that creates a lot of that stiffness, particularly the younger spines and the discogenic type of issues that we're dealing with. And so that's why once we've been up for a while, 45 minutes or so, the research shows, upright against gravity, walking around, go get a nice hot shower or something like that, and we can actually get the disc back to its normal size. So research shows about 90% of that extra liquid that's accumulated overnight gets squashed out by about the 45-minute mark of being upright against gravity. Now, this is even some researchers took us even further, and there was a rudimentary study that was conducted in 1998, and what they found is that actually limiting spinal flexion in the morning for patients with what they called non-specific low back pain. We'll just digress from that for a bit. They basically got these patients to stop flexing their spine for the first part of the morning when they woke up. And what they actually found is they reduced the significance of back pain and the intensity of back pain and occurrence of back pain in those patients just by stopping flexion of the lumbar spine in the morning. Right. And again, it goes to that hydrophilic effect of the disc. If you're bending forward with a more swollen disc that's full of liquid, it acts more hydraulically and can bulge out more and cause issues. Okay, number 8. What are the signs of serious back problem? I think in my case, all back issues are serious, right? And, if you can address them earlier when they first start to rear their head, I think it's a lot easier. As the saying goes, prevention is better than the cure. So the quicker you get onto those issues, the quicker they can be addressed. But I would say any issue that lasts for more than a couple of days, so you're getting back pain that lasts more than 24 hours or keeps happening, keeps reoccurring, and if there's neurological involvement, nerve pain, weakness, etc., then that would be, really serious back pain. But as we're saying, I think all back problems are serious, but need to be obviously nipped in the bud if you can. Number 7, can stress cause low back pain? So this may be a bit more of a controversial one to some people out there, but I don't believe that stress can cause low back pain. Now, it may exacerbate it and can cause increase in sensitivity. Sure, cortisol, our stress hormone that gets released when we are stressed, can definitely increase different sensitivity in some areas as well, and can definitely play its part in increasing that sensitivity. But there has to be an initial injury. There has to be tissue damage to start it. So I don't think stress can actually cause low back pain by itself. And as I say, I think some people out there like to just blame the patient and say it's all in their head, stop stressing about it. But again, there's actual root cause, there's a mechanical cause, and we've got to actually identify that. That leads us on to question 6. What are the best exercises for low back pain? And this is one that I get asked all the time. And as the saying goes, it depends, right? So it depends on your mechanism, depends on the individual context. So we're dealing with more of a disc issue, we're dealing with facet joint issues, we're dealing with spondies, instability versus compression intolerance. So it depends on the actual person. However, to try and give you guys more insight and more of a solid answer, I'll steal this one from Joel Proskowitz. And again, a previous podcast guest. And what he said the best exercise is for back pain and back issues and spinal health in general is walking. So this is due to the cyclic compression and cyclic loading that occurs on the spine when we walk. And this helps to expel any excess liquid that is accumulated in the disc. It can also help to obviously improve circulation. When we're walking, we can get our heart rate up a little bit more, which can increase the circulatory system. Then we've also got the lymphatic system, right, which is where our old products and inflammatory waste products and all that stuff travel through, is the lymphatic system. Now, the thing about the lymphatic system is it doesn't have a pump like the heart is for the circulatory system. And the lymphatic system relies on the muscles contracting to actually literally squish and squeeze the lymph fluid back up towards the kidneys and all the rest, and then get filtered out from there. So walking, one of the best things you can do, if not the best form of exercise for low back pain, if you're able to walk. Number 5, is walking good for low back pain? Well, see the answer above, number 6. Yes, if you are able to walk, it is one of the greatest things you can actually do for your spine. And what I love so much about walking is that it's a low cost of entry, right? So you can literally, you don't even need to put on your shoes. You can go barefoot. Get outside, walk. You can walk up and down in your house. You can walk around the block. You don't need to go to a gym. You don't need to pay for a subscription. You don't need to do any special, programs or anything like that. Just literally get outside and walk. Even in some cases, we've got, FIFO here in Australia where patients fly in, fly out to different mining sectors, and they are out in the middle of nowhere. And so we literally tell them to walk up and down in their little room that they've got. So walking is one of the greatest things, if you're able to actually do, that you can do for your spine. All right, question 4. What is the best sleeping position for low back pain? Well, this one again depends on the individual and their unique factors of their condition. As a general rule, sleeping on one's back or side, sleeping is generally pretty good. And you can tuck a pillow in between your legs when lying on your side. You can even hug a pillow around the arms as well. And we want to try and, again, as a general rule, avoid tummy sleeping. So this is because the spine gets put into some significant extension, and in that position for an extended amount of time can cause aggravation to different parts of the back of the spine, like the facet joints, for example. So we don't like tummy sleeping. So either back or side. Now, tummy sleeping also places the neck into a bit of awkward position because you obviously got to turn and face either side to breathe. So that can put a lot of torsion on the neck as well. So yeah, we don't like tummy sleeping. Now, when you are lying on your back, if you do have issues where lying flat's causing pain, such as extension tolerance, facet joints, etc., then what you can actually do is place a couple of pillows underneath your knees when you're lying on your back. And we want quite high to get that lumbar spine back into neutral position. Because when we're lying flat on our back, our legs are straight, our pelvis and hips being higher than our lower back will actually tilt into a little bit of extension. And for healthy spine, no issues. But those who are extension sensitive may find this position uncomfortable. So try a couple of pillows underneath the knees when you're lying on your back. And that tends to bring the spine back into neutral position and obviously reduce the aggravation. Then when we're lying on the side, as we said before, try a pillow in between the knees. Just helps to keep the knees a bit more square, and therefore there's no twisting of the hips as you're lying down. Okay, question number 3. We're into the top 3. How can I relieve low back pain at home? This is a great question. And I think it goes individual factors, but what you need to do is find your position of respite. Okay. Now, this position of respite is different for each person. And again, goes to their individual mechanisms that they're dealing with. So you've got to try and identify yours. And this is your go-to position when things get sensitized. I always say to my patients that we see in pretty acute conditions that utilize this one throughout the day. And on top of that, anytime that you feel really aggravated, go for it again, right? And so a good one to do for most people is, especially with their disc issues, is to lie flat on the floor. So if you're dealing with disc issues and not extension intolerant issues, generally flexion is going to be a little bit more provocative for the disc. So lying flat down on the floor, again, we don't want to sleep in this position, as we said for the previous question, but just lying flat there down on the floor just gets the back into a nice gentle extension position of the lordosis of the lower back. And you literally just turn your head either side, lying down there on a hard surface. And for disc issues, we are unloading the disc and can actually place it into a little bit of extension, which in some people can actually get the nucleus, which is the center gel part of the disc, that can protrude backwards to start to migrate back to the middle of the disc. Again, for the right person, right time. Now, those who have a little bit of extension intolerance, so again, facet joints or a spondylolisthesis or something of that nature, we like that position, but what we suggest is putting a rolled up towel or pillow underneath your hips. What that does is help to just place the spine into a bit more of a neutral position. So instead of going into a little bit extension from gravity arching the back a little bit, the pillow or rolled up towel underneath the hips will keep that spine nice and neutral. So we're not loading those posterior elements like the facet joint or the pars bones. And that can be quite relieving for a lot of people. Those are generally 2. Again, trying to find the one that works best for you. Sometimes patients like to lie on their back with their feet up on a couch, so sort of at a 90-degree position, and some can find that relieving. And you just got to find the one that works for you. But if you want to try out our what we call position respite, which is lying face down with the pillow underneath, we have made a video on our Instagram, and we're also going to make a video on YouTube as well, so you can go check those out and visualize what we're talking about, because it does work for quite a few people as well. Okay, number 2, when should I worry about low back pain? I'll say my answer is pretty similar to the previous one, where I think all low back pain should be taken seriously. Again, prevention is better than cure. So if you start to get those little niggles or some aches, try to address this issue first up as quick as you can, right? And addressing that issue, what I mean is identifying what is going on, the root cause, and address that. As low back pain and spinal disorders can be very complex and become more tricky the longer they are left, whereas treating them early you really can make a big difference, and it can be a lot more simpler and a lot quicker to address when you treat them early. So we got to make sure that we treat all low back issues as serious. But when should I worry about low back pain? The sooner the better, right? If you're starting to get niggles, then just address it early on. And okay, finally, down to number one, the most common searched question on Google regarding low back pain. And as I said before, I find this quite funny because it's the most often searched question, and meaning that everyone wants to figure out this answer to this question. And it's what causes low back pain, right? And the reason why I find this quite funny, because again, this makes sense to me, but the reason why I find it quite funny is that so many patients we see have seen multiple practitioners, all the different physios, chiros, osteos, sports doctors, surgeons, even specialists, other OTs, all that sort of stuff. And one of the questions I always ask them when they've seen multiple practitioners is, what did they tell you was causing the issue? And most of my patients will reply, well, they didn't really tell me. Or they'll say, oh, it's a disc issue. And I said, okay, well, what about the disc issue? What's the actual mechanism? Because there can be multiple mechanisms that can cause disc issues. What is the underlying cause? What is the exact mechanism that you're dealing with? And so many patients, if not all the patients that I see, have never been given that direct answer from the actual clinician. So the reason why I find it interesting is a bit of I guess it's unfortunately a poor representation of the health practitioners out there, right? They just say, oh, it's tight back muscles, or oh, you're just getting old. That's one that really annoys me is, you see older population, they go, oh, it's just because you're older, or you got degenerative disc disease, which again means absolutely nothing. And so you need to actually identify the root cause. And then that's where we often say to patients, back pain is a symptom, right? It's not a cause. And to me, it makes sense that the first question that patients should be asking is, what's causing the issue? Because if you don't know what's going on, how can you pretend to be treating it, right? So I always say to my patients, if I go to my doctor and I say, okay, I've got finger pain, I've got pinky pain, right? And we've got to figure out what's causing it. So is it a cut? Is it a broken bone? Is it a bruise? Is it a torn muscle? Is it an infection? Each of them are different, but yet they all cause finger pain, right? And so if we go by treating it as finger pain, what might work for some is not going to work for others and might actually make another population even worse. So that's why you've got to identify what's causing the issue so you know how to actually treat it. And saying, tight muscles and all that stuff that we spoke about before is not an actual answer. So make sure that you can actually identify the root cause, right? And if you can't, and if they say it's a disc bulge, prompt them further and say, what about the disc bulge? And if they can't answer that, well, maybe it's time to find a different health practitioner. And, for us, it's really about addressing the cause. So if you're tired of chasing symptoms and stuck in a rut when it comes to your low back pain, then please book in a consultation with us at Perth IPC and Perth Injury and Pain Clinic and actually get on top of your low back disorder. Actually find out what's causing the issue, and therefore you can start the treatment and the rehabilitation and get you back to doing the things that you love to do and move pain-free. So there we go, answering the top 10 questions that are searched on Google regarding low back pain. Hopefully you found this informative. I wanted to keep it relatively brief just so it can be answered and nice and quick to listen to. If you do have any questions specifically about these, flick them through to us at Perth Injury and Pain Clinic on all our socials. As we said, check our YouTube and all that with good information. Hopefully you found this informative and insightful. And I'm just saying, got to identify that root cause, right? So make sure you identify that because that guides the rest of the treatment and rehabilitation required. Hopefully you're all having a good rest of your day, and we'll see you soon. And as always, from my end, keep healthy, keep learning, and keep doing what you love.